This is right now. You can start. I'll bring a few of them to say that you need to join. But you can essentially start. That's live.
Searching for the first time.
This so that you see these. You can start.
Good morning. Good morning.
Nobody's going to come.
There's a lady who joined the first time.
Just leave it here. See how we did. I've opened a window there. Don't actually need a mouse, but in case.
Other ill finches.
Something like that.
Good morning. Hello, Eunice.
Hello.
Hello, Eunice.
Hello.
Hello, Eunice.
Hello, good morning.
Sometimes these students don't join.
So I can start.
Yeah, it keeps starting.
Yeah, but I can't hear them. All right, that's fine.
Maybe that's fine. You can switch off the video in just a couple of minutes.
Okay.
Hello. Hello. Hello.
Hello, Eunice, can you hear me?
Yes, I can hear you now.
All right, this unit. Well, good morning, guys. My name is Daniel Amensa. I'm your lecturer for today. I guess you can all hear me. Well, we look into this model, which is management of health and social care provisions. And our aim today is to ensure that we have effective managers within the health and social care requires a need to supervise and manage provisions and lead and support others. This unit, we looking to develop the students' knowledge and skills and understanding of the role of a manager within their managing provisions and practice in health and social care in ways that continually improve what has been delivered. All right then. We're looking to expand more and develop our knowledge within the managerial roles and the management of health and social care. And it's important the students tend to understand some of these things and the process in managing healthcare. What will be your understanding, should we say, management of health and social care? Perhaps if you are from Nigeria, Ghana, India, Pakistan, I'm sure back home, most of you might have your NHSs and probably have hospitals, different hospitals in there that manages it. But when we talk about the management of health and social care provisions, basically we look into the organization and processing of healthcare and health services. That includes probably the facilities itself, and also the planning and coordinating and controlling of some of this healthcare. So it is important that we know some of these things within the management of healthcare. It's planning in everything or every organization is key. Planning is key in everything. There must be proper planning in the management of healthcare. You cannot just stand up and do things anyhow. There should be an informed decisions. There should be proper planning being made available, both from the managerial perspective or management perspective. So there should be planning, and there should be effective coordinating as well, so that the planning that has been put in place probably will transcend to the junior managers and probably staffs beneath the management. And controlling of various aspects of healthcare and social care organization to ensure, what's the reason why we do all these things, is to ensure that we have effective and efficient provisions of services to individuals and communities. I mean, when we talk about healthcare, the primary goal is the service user. The primary goal is the patient. The primary goal is the needs of the patient. And therefore, our plannings and our coordinating should be geared towards effective, efficient provisions of services to those individuals and the public as well. Very important, you know, and our concern of managing resources such as healthcare facility, the staffs, the budget that comes, the allocation of budget that comes, technology, and to meet healthcare needs of the population. We all agree that in the various countries, there are budgets every year, probably from Parliament, allocated for healthcare departments and healthcare towards the population. When the population increases, then there must be review of the healthcare packages and a review of budget allocations for the population based on population increase, and probably based on older people and the aged and all that. So therefore, these things goes into planning. And allocation that was given probably 2 years ago might not be the same for the current year because of population increase and all that. And therefore, these things comes into management of healthcare. There should be proper planning and proper coordination to give quality care. You understand? And this management can either be administrative or clinical. You understand? Because I mean, you are going to work with nurses and work with doctors and going to work clinicians. And therefore, they all form part of the management, where you have top executives and all that. But beneath, you have in hospitals or in the UK, the NHS, as a case study, you need to have nurses and patrons, clinical leads, clinical managers, patrons, midwives, radiographies, and all that. And therefore, they are heads of departments for each department, for each department. And therefore, the top decisions are made, and they transcend, or they are delegated to head of departments, and the head of department will also pass on to various sub managers and all that. And that is why it is administrative and also clinical, you know, yeah. But one key thing is, and for those of you who have done the level 3 health and social care, you realize that I spoke much about a bit more on the provisions of the Health and Social Care Act 2028, which was not the best in the UK, and therefore there was much planning and thinking, and reviews were made to sort of mitigate what was not appropriate. And this leads into more of strategic planning, because anything that is not the best and that was not meeting governmental policies and not meeting the needs of the citizenry or the needs of people within a country or within a particular locality, there's a need to have strategic planning in ensuring that these things would work. And therefore, strategic planning may be a short-term goals and a long-term, but in most times, strategic planning leads to is something that evolves around long-term goals, you know, to be able to meet the objectives of health organizations and formulate the strategies to achieve them. You know, so the strategic planning will lead to policies being reviewed and policies being crafted and all that. But there must be the strategies to drive those policies that has been made. You know, there must be strategies. So whenever you have long-term goals, you have what we call your vision, which forms part of your long-term goal. However, there should be a mission that you will use, or a medium or a conduit to what you have to use to achieve your mission. So your long-term goals will be that you want to increase the number of nurses intake that's coming to the UK, or you want to decrease the number of nurses intake that will come to the UK. They all fall under the healthcare. However, what measures will you put in place to ensure that that vision that you have, your long-term goals, you can achieve them? You know, it might be in relation to populations or identifying certain stereotypes and certain needs within. It might be too many people are dying, or probably too many aged people who might not necessarily not getting the support, and therefore you want to increase the package, the allocations, and therefore strategic planning is more to do with long-term goals and the process you're going to put in place to achieve them. You know, and the organization structure. You know, you have to establishing a structure that design healthcare organization to ensure efficient communication and decision making and coordinating among different departments and units. You know, so in every organization or every we have what we call the onogram or your organization structure. You may have your chief executive, and then you have a deputy chief executive. You have medical directors, and then you may have beneath it, you may have clinical leads for this, clinical leads for that, and all that. And so those are and they work they connect each other, they work interconnect, they coordinate to be able to achieve one goal, the strategic plan goal. So once you have your plan available, the organization structure of the people that heads, they have to work hand in hand to be able to achieve that goal that have been made by the organization or the hospital. And then we're talking about human resource management. I'm sure many of you will know anything that is connected to human resources, talking about capacity, it's talking about managing people, and that involves ways of managing people. Could be in training, could be the recruitment of staffs to meet up the needs of the hospital, or the needs of the organization, or the needs of the country. It could be population needs, and therefore they need much people to be recruited. As you are aware, the UK is bringing a lot of nurses and doctors and name them into the UK. Canada have just started. Germany has also started. So human resource capacity, once you have identified a need, you then do what we call the strategic planning is done. You have your organization structure in place, and then you do your human resource management to meet the needs that you have identified. And those needs are recruitment, training, managing of the healthcare professionals themselves, and the support staff to ensure availability of skilled workforce. The same thing I've said, the UK has opened doors to many nurses and healthcare professionals beyond the UK who seek to come to the UK and work. And so there was a need that the UK government identified, and those needs were when they're doing the COVID, a lot of people passed away, you know, and therefore they need quite a number of skilled workers to come and help, because there's a huge population of people coming to the UK. And so they identify a need, they put in a goal, they make sure they put the labor and the force available. And then the final bit is the financial management. You ought to have your finances right. You need to have those who are going to manage the budget, that you have the finance managers and all that, Secretary of State, Secretary for for the medicals and all. So you have to have the finance management team in place to be able to manage the financing, the budget, and account for them. It involves monitoring of all those in the auditor generals and all that. So these are, but then when you have spoken on financial money, there's ought to be what we call quality assurance. How do you measure quality? How do you measure that your long-term goals or the decisions that have been made? How do we know that you are meeting those goals? There should be quality control, but then there's quality assurance as well. Whilst you are ensuring that the quality of care that is being given is meeting your long-term goals, you know, and you're not deviating from your long-term goals. So quality assurance, implementing processes and systems to monitor and improve the quality of provided. It includes quality standards, conducting audits and evaluations, and implementing quality improvement initiatives. You understand? So you are sort of ensuring, whilst you have your quality control, but you have your quality assurance. And so they are a form of expertise or experts who will be there to ensure that your product, which is your need, a product that you are putting after you identify your need, the product you are putting in place, there must be quality assurance team or experts to ensure that the healthcare being provided or the allocations being given, they are meeting the target group and the need. You know, and then information management. Obviously, there should be proper, effective communication. And you cannot be effective communication without the usage of information systems. You know, how do you disseminate information? How do you ensure that there's data protection? How do you ensure that you know certain information are not being given out? How do you ensure that clients and patients have their information protected? And so this they all form under information management, utilizing technology and informing system to collect, to store and analyze healthcare data. You know, there's what we call confidential or data protection. You have to make sure that in as much as you have a long-term goals and you have a need, there should be proper storage of patients and staffs, their information. So there should be a proper department to ensure that you handle their information very well. And another thing we need to also take is collaboration, partnership, you know, partnership, strategic partnership, relationships. You know, there should be people, organization, department should work hand in, agencies should work hand in hand to achieve the primary goal of this, you know. So you may have Department of Health, you may have Department for Population, Statistical Services, you may have all these things. They need to work hand in hand to achieve this goal. Interdisciplinary collaborations. So you collaborate to ensure that the ultimate goal, the governmental goal or the budget that have been given, they all come together and achieve that role. But coordinating, you know, governmental agencies come together to achieve. So you may have the population or department, you may have the Department of Health, you may have the NHS in the UK. So you may have different, what do you call it, government agencies that collaborate together to ensure that there is effective government policies to meet the long-term goals that government have come out. Or so yesterday I spoke about the multidisciplinary organization, social workers, the local councils, the consultants. They all come together to ensure that they achieve a goal when there's a need. Okay. Now we also have the policy and regulation that comply with healthcare policies, regulations, and legal requirements. Healthcare managers need to stay updated with changes in the healthcare policies and regulation to ensure compliance and adapt to organization accordingly. So there's important that the healthcare managers or chief executives, name them, they get themselves updated with new changes. Because if you don't get yourself updated with new policies and all that, how then could you pass on to your junior staffs? So regular trainings, regular workshops, they are very important that healthcare managers need to know, you know. And some of the, what are some of the key technologies that we have to look into? Who are healthcare professionals? You know, who are healthcare? They are professionals who work within the healthcare, nurses, doctors, radiographies, and all that. And what they seek to do is to just prevent illness and injuries for the public, against the public. That's all they do, and support patients. You know, so a doctor, a medical doctor, opticians, all they do is to prevent illness and injuries, you know, against patients. Some common example, as we all know, physician, doctors, and all that, we know them. In general, what they seek to do is to promote and monitor healthcare and well-being of individuals. That's the role of managers. They just want to see the well-being of people, just like nurses do, and just like doctors do. You understand? Yeah. And if we can play this, and then if we can watch this video, just let me play this video, and then so it's not playing up, copy this. Copy link. Just 1 minute. So I'll play this. Okay. So I'll upload this so you can. Okay. Just 1 minute. Okay, so I want to play this so you can www.DiHSC, just 1 minute. Safari. Okay. Safari. Okay. All right then. I might need to proceed with this. Okay. Need to watch this. Just 1 minute. So,
Johnny, you can right click
the
on that.
rows.
Right click on it. Right click. Select it completely. Then right click. Yeah, select it completely and then right click. Or you can open a new browser window and type it also. Right click on this, copy, and then paste it in a new window.
Paste.
Open a Chrome browser. Yeah, copy link, open Chrome browser. This is your PDF viewer. Open the Chrome, your Internet Explorer, Chrome.
All right. YouTube. Okay. Yeah.
Hi, Eunice, can you hear this in the background?
Yes, please.
All right, okay, that's great. Thank you. So running first to press escape, response to and stop show, and then change it to the window. This is showing to show all the NHS campus. There's an audit from the link. If you go down, actually on the website itself.
On the website.
Yeah. That's right. So basically, there's a link on this for them to be able to visit all the NHS. So Eunice, you can watch this a bit later with the video. The reason of having this hyperlink here is, assuming if you're looking at getting into, health and social care careers, there is an option on the NHS website which allows you to explore your careers according to your traits. What careers can you actually, take up in the NHS? So you can find your ideal role by clicking on this. It'll ask you to take a 5-minute survey. and it'll ask you a couple of questions. Once you answer these questions, there are 360 different career options in NHS. So depending on the skill set and the answers that you give, what it is going to do is basically suggest you the ideal career in NHS. So the career video is obviously just an opener, but the main reason of having this here is to actually look at you exploring the roles that you can actually take up in the NHS basis your skill set, your knowledge, and your personal traits like your attitude, your attributes that you have and things like that. So this is a website that you can use to actually explore what would be the most ideal career for you within the NHS. Is that okay?
Yes, please.
Now you can go back. Stop share. All right, share again.
All right, Eunice, thanks so much for your patience. Good. Hello?
Hello?
Eunice, are you okay?
Yes.
So let's proceed. Yeah, so we have to analyze the roles and responsibilities of managers in the healthcare provisions. I mean, how important are they? Eunice, what do you do? What's your profession?
Hello?
Yeah, what's your profession, Eunice? What do you do?
I'm a carer.
Are you a carer? Okay.
Yeah.
So what are the roles of managers within? Are you in a care home or are you with a supported living for hospital? Hello? Hello, Eunice.
Hello?
Can you hear me?
Yeah.
Are you with a hospital or a care home?
Care home.
Care home. Okay. So what's your understanding? What are the roles of managers? I mean, within your managers within your care home?
They make sure that everyone does his work or her work correctly without any trouble or something. Yeah.
Without any trouble.
Yeah, they see to it that everyone has done his own work.
That's fine. That's fine. So in other words, the managers are more like those who ensure that everything goes well within the care home. Am I right?
Yes.
Good. So in so doing, you need to be on top of your what you do. You need to be you need to have the leadership qualities. Let me put it that way. I don't think any carer want to work with a manager who is a bossy manager. Would you?
No.
So you need to have the leadership qualities. You ought to understand where you are. You need to have the necessary qualifications within the healthcare. And then you need to be a leader and not a boss. And you need to be able to work and be a team player. Identify the needs of your staffs. I mean, when a staff needs to be trained, you need to be able to look at the skill sets of various staffs of your various carers when they are due to do their annual trainings, mandatory care trainings, or trainings when we get to DBS, which is a spine. You have to make sure that if the roles of the carers involve complex care or involves dementia, you need to have, if it involves mental health workers, a leader or a manager should be able to know that they will need to have the PMVA trainings and all that. So these are the things. So these are the roles that they do. So they ensure that there is effective quality. However, like you've said, you may have a top management team that comes out with the goals, strategic goals, and that is beyond the managers. But the managers pick up these goals. Every care home has its own policy, have its own missions, and have its own visions. And every care home may have the number of service users. It may be some may be 20, some may be 30 beds, some may be 40 beds, 35 beds, and all that. And every care home may have different service users. Some may be dementia, learning disabilities, and name them. It is up to the manager to ensure that carers up to the managers to ensure that carers are up to task with their trainings and up to task with their DBS and up to task with the role that has been given to them, and anything that the carers lack, they have to make sure that they do them and make sure they happen. So these are the things that they need to take notes of. So that's what managers do. They put in strategies and make sure that there is effective communication and effective working environment to achieve the company goals and objectives. Another thing is that the finance part of it. You know, they are responsible for managing budgets and allocating resources effectively. And when we talk about managing, it might not be probably the manager itself, because we may have a finance manager as well, who is an expert. So in many homes, you might not have the same registered manager being the finance manager, you know. So you might have a finance team that deals with finance and payroll. And you may have other managers that deal with the clinical things and they may have other managers for other things, safeguarding and all that. But they are all managers, you know. So there may be somebody in charge of managing budgets, allocation of resource effective, and ensuring that there's financial sustainability. If there's not, how would they pay staffs? How would they buy clinical things? How would they buy all the things that you need to take care of, what do you call it, the service users or the patients, you know, and to make sure that there is transparency and allocation of services. And also it involves a lot of planning, you know. Yes. Again, human resource management. The same managers, you may have recruitment managers, or you may have a compliance manager. And what they seek to do is in the area of recruitment. Probably when you were being employed into your care home, I'm not sure the same manager you met was there. You know, you may have a team, managerial team in charge of recruitment and training of staffs. They may be different from the managers that deal with finance and managers that deal with payroll and other things. So that is the role they play. In a care home, you may have a manager for compliance, a manager for training, and a manager for finances. You know, and then you have the quality assurance and compliance. I just mentioned it. The quality, and all compliance seek to do is to ensure that the services that have been given is meeting the goals that the company or the policy that the company has. So compliance, some of the compliance is making sure that you as a carer, you have the right to work in the UK, you know, and you have the right or the right skills for the job. The advert that they put that you have the right skills, you have the experiences that they need, you have your DBS up to date. These are all part of compliances and quality assurance, and ensuring that your trainings have not expired. They need you up to date. So on the junior level, these are the first things that they look at. But in the external level, probably in the managerial level, there are a lot of things that they have to look into, the policies and all that they have to meet. They have to make sure the services they are on. They are giving out the feedback they are getting from the carriers themselves, what we call annual appraisals, the carriers themselves, and also the service users themselves, the feedback they are giving from their parents and probably for their family members. You have to put back the feedback and ensure that you reviewed the feedback you are getting. So these are all for part of quality assurance and compliances. You understand? I'm sure Eunice, in your workplace, what do you do? Do you do annual appraisals and all that? Eunice, can you hear me? Okay. Then we have the stakeholder engagements, you know, and when you say stakeholders, in organization, you may have different, you may have social workers, you may have the manager itself, so, and even the clients or the families, they are all stakeholders. So the people you are taking care of, they are stakeholders. The finance manager is a stakeholder, the manager is a stakeholder, the social worker that refers to is a stakeholder, you know, or the NHS. So you work as a team, stakeholder. It is important that you annually have stakeholder engagements. You know, you annually have engagements. You ensure that there's effective or regular stakeholder engagement to reveal or to look policies that need to be revealed. Those are all part of feedback. So you both tell for the decision-making processes to ensure that services meet the needs of the population served. You know, so in government, they do what we call yearly, you know, collection of data to ensure how many people, you know, because there may be new children that have been given birth, the population increases. So there's the need to engage the citizenry or the populace or the population to collect data and know the number of people and that will help them in terms of review of their healthcare policies and review of even accommodations and rentals and all that, you know. And then we have what we call risk management. Risk management is very key in healthcare, very, very key. And one of the things that managers do, because for you to be able to know a patient or a service user, what they will need in a care home, you have to do risk assessment or risk management. So, and what we normally have in what we call in care plans. So normally what you see in the care plans as a carer, these are the things that a manager would have done already in assessing a patient and identify their risk, and that they will put it in the care plan so that it would help what we call person-centered care. It would help to meet up the needs of the patient as well. You know, you say identify and mitigate risks within the healthcare environment. They develop protocols and procedure to minimize potential hazards. You know, so you know hazards likely to cause harm. Anything likely to cause harm is an hazard. So the quality control hazards, the hazardous items and all that. That's why you go to trainings and they ensure that you know all these things and the hazardous products, what we call COSH. You know, you need to know all these things. You know, yes. Okay. The continuous improvement and innovation. Managers foster a culture of continuous learning and development, as we all know. Like I did mention to you, you have to identify what you lack as a staff and put you to necessary trainings. You know, and then advocacy and public relations. They advocate for an organization promoting their services and building positive relationship within the community. They represent the organization in public forums, participate in healthcare networks, and collaborate with other organizations to address community health. So if it's about a community nurse or a manager, social worker, this is what they do. You know, this is what they do. They collaborate and advocate. You know, they advocate. In the UK, there's a lot of advocate organizations. They advocate and ensure that healthcare networks and represent organizations for various functions and all that. So I can say in the whole or in the national, managers in healthcare play a crucial role in ensuring that the effective delivery of services come to place. You know, it involves their risk management, management of human resources and all that. These are all major things or major roles that managers do undertake. You know, yes. And we could also look at the styles of management. You know, what are the approach? Like I said, you may have a leader who might be very autocratic, you know, so the styles of leadership. I don't think anybody, but there are different managerials and different skills. Every person may be different in their approaches. There are those who prefer to go very liberal in dealing with that. There may be those who may be very autocratic, you know. So there are styles of leadership, you know, that involve the approaches and behavior that, so some autocratic, when somebody is autocratic, managers make decisions without much input from employees. And that is not the best of leaders or the best of manager. They make decisions on their own without not consulting even the carers, you know, and that's very bad. It's not the best. And we are democratic, you know, that involving in decision making. That's the best. That's the leader. That is a team player. Not because it's you're a manager, so you don't listen to the views of your subordinates or your carers. So the best leadership for me is democratic and not autocratic, you know, and transformational, you know, inspiring and motivating employees to achieve exceptional performance. Managers in this type encourage people growth. There are people like that as well. There are managers who they are always concerned about your growth, about your empowerment, about your well-being. That's another style of leadership. And that the Lazarus Ferry in the management is the manager that provides minimal guidance or direction. It's more to do with the autocratic as well, but they give you, they're not too concerned about your well-being. All they are concerned about just the work, and that's it, you know. Yeah, that this identifies skills for health and social care managers, such as leadership, communication, problem solving, decision making are relevant areas. You know, effective managers adopt their style based on situation, organizational culture, and the needs of their own team members as well. So in effect, what it means is that sometimes a manager would have to adapt style of approaches based on the team members. You know, if probably the team members are quite intelligent people, probably the manager may not put in a lot of input, but it is if there are team members that may require a lot, or they lack, or they are quite new in care, then the manager will have to put an extra input to make sure that you achieve your goal. But probably you may have some team members who are quite intelligent and well experienced, and probably the manager will not put in much work, you know. And so what are the disadvantages of or advantage of autocratic? You know, like I said, quick decision is made, you don't involve no one, you do things on your own, but it's very bad. Disadvantage is limited employee engagement, reduced creativity, and potential low morale. It's true, because you don't involve anyone, and therefore the staff don't find the need to be there, and therefore they do engage. And so there's reduced creativity, there's no innovative, there's no initiatives from the staffs. There are no initiatives. And democratic is that increased, because democratic is the best way of dealing with people. You will involve them in decision making. They are also able to give back what they know, and it helps to build stakeholder engagement. It enhances them and enhances the job as well. You know, increase employment involvement satisfaction, diverse perspective. It will surprise you that managers will not know everything, but you may have a carer who may add certain value to the business, certain value to decision making. There are things that the carers may know that managers may not know, and that is why it's important to be a team player and not a boss. You know, but it might be time consuming as a disadvantage, because I mean you need to go an extra mile and get people involved in. And the transformation is because you motivate and inspire employees to work, so to speak. You build a culture where people are more involved in the work, but it also requires long leadership skills, potential for resilience. You need to have you have to have known the people for quite a long time to make such style applicable, you know. And the laissez-faire advantages, it encourages autonomy and creativity, fosters innovation, and supports self-direct teams. However, it lacks guidance and oversight. But so I think that among the three, the leadership skills that one would have to emulate will be the democratic style of leadership as well. You know, whilst you can take a bit of the transformational, because you motivate people, encourage them, you concern about their well-being. You know, now what we call as evidence-based practice? What do we call that? Or what is evidence-based practice? I mean, in healthcare, everything we do must be evidence. I mean, you go to care as a care in a care home, you have to document everything that you do as a care. You know, I'm sure if you're a carer, Eunice, as you said, you have to document everything that you do from if it's an 8-hour shift or it's a 12-hour shift, all the things you do from afternoon to morning, you have to document. So evidence is very key in healthcare. It involves integrating the best available evidence with clinical expertise and considering patients' preferences and values, what we call person-centered care. While it's primarily associated with healthcare professionals delivering direct care, managers in health and social care provision can only apply evidence-based principles in their decision-making process. You know, can also apply evidence-based principles. So you have to make sure that the principles you are evidential, the evidence to back it. And one of this is your care plans that they will do. There must be evidence of supporting evidence of what the patients like and what they don't like, you know, within a care home or probably within an hospital. You know, managers must make sure that they have evidence, and you as a carer as well, or you're a team leader, you have to make sure anything that you do with your team, you document them, you know, so that it will set as a preference that people can look on. You know, when a new staff come into the care home or into the company, these things are laid down principles that you would have stated as a team leader, so that it's easily for everybody to adapt or anybody to adapt when they are new. This informs part of your training. So evidence-based principles is one of the things that managers need to include in their decision making. You know, they also have to use in doing findings and research and guidance, and the best practices, which is very important. The best practices that managers, very, very important. When we say best practices, they are things that managers have to do. They are things that carers have to do and not to do. You know, so they are best practices, especially safeguarding things that you have to do as a carer when you go to a care home, and things you don't have to do. But you have to choose the best practice, and that involves managers to do that as well, to make sure that the carers or the subordinates will also follow. It helps improve the patient's satisfaction. What we call person-centered care. And that is why you have care homes, you have care plans. You know, in some homes, you even have communication book, you know, and you also have, what do you call it? The ability to even your complaints policies and all that, you know, yeah. So we have to compare the observed and perceived style of management. When comparing observed and perceived management styles in health and social care provisions, it's essential to consider actual behaviors exhibited by managers and the perception of those behaviors by employees or team members. Like I said, everything that you do as a manager, you will be judged by your team members as to whether you're on track, as to whether you're autocratic, as to whether you are as to whether you are kind. You are kind and all that. It will be judged by your team members. There may be situations where managers intend to adopt a particular style, but their actions and behavior may perceive different by their team members. This discrepancy can impact the effectiveness of managerial practices and employees. It is true. And a manager may be probably a democratic, you know, but as in person, but he may be seen by his subordinates and staffs as autocratic. You know, and the feedbacks from your staffs and the feedback from your carers or your subordinates would inform you, you know, how then to go about things. You understand? Yeah. Managers should strive for consistency between intended management style and perceived style. You know, open communication. So your style, you in your mind, you think you are not autocratic, but then your staffs or subordinates may see you to be autocratic. And the only way you can find out is the feedbacks. If you give room for feedbacks, you would get to know this and then inform them and tend to a better lifestyle, a better style that would help organizational goals to be achieved rather than being autocratic. So feedbacks play a major role in that. And you have to analyze how effectively prioritize and delegate work. In managerial role, there's no proper effective manager who does not know how to do. You have to know how to delegate. Delegation plays a major role in management because you can't do it all. And that is why you have carers to help. You have cleaners in the hospital. When you go to the NHS, you have cleaners, we have carers. We have all kinds of people. We have the kitchen staffs and all that. They are all working as partnership to build a common goal. You know, so delegate. You know, delegation helps you to prioritize what you are good in it and give others to people who are good in certain things as well. You understand? Yeah. So assess importance and urgency. Start by evaluating the importance and urgency of each work. Determine which tasks are critical and require immediate attention. Use time management techniques. You know, for many of us who go to work, what do? You set an alarm, 5 o'clock. You have to wake up and go and bath. So these are all time management techniques. The same way managers have to do the same. You know, so you put time alarm, but to wake you up early so that you don't late to work. So employ various time management techniques such as creating to-do lists, using calendars and all that. We all do that in our homes. You understand? Yes. And then identify key result areas. You know, identify key result areas, the responsibility of each team member, you know, understand their strength and skills. Very key. This is only when you are democratic and not autocratic. Because we've said earlier that if you're autocratic, you will not get feedback. Your carers will not open up to you. Your subordinates will not open up to you. Your team workers will not open up to you. And that will not help. So a key strategy is that when you are democratic and you are quite open, then you get to know the strength and the abilities of your subordinates and you can help them. Communication, clear expectations, effective communications, effective. You know, clearly communication, objective, expectation, deadlines associated with each task, making sure that you encourage them that there are deadlines to achieve. It is the training that they have to do, task them with deadlines so that they can achieve those deadlines. And if they are not achieving it, try to get yourself involved in helping them to achieve that. Delegate appropriately. You know, don't just delegate. You have to delegate when it is needed. And you need to know you can only delegate a job to another person when you have known the person's strengths and abilities. You know, when you have communicated, then you can delegate. But you communicate to people whom you know they have the strength in certain field and certain expertise. Just like in your home, a father or a mother know the strength of their children, and therefore they know when to delegate and what to do and what not to do. You understand? Yeah. And then provide adequate support. Again, when you delegate, you don't just leave your carers or your team leaders, but you have to inquire where you feel they are lacking, where they need some support, and then you give them that support to enable them to achieve. Because at the end of the day, what you are seeking to do is an overall goal, not only you, but to achieve company goal or population goals or whatever goals that you seek to achieve. It is a general goal that you all seek to achieve. It may be a target that probably by the end of that year, you have to achieve a target, you know, of maybe 20,000. And you cannot sit down and say, because you are the manager, you have to pat yourself, get yourself and support them. You also have to open up accountability, you know, accountability, recognizing and appreciating the efforts of achievement of team members and motivate them, you know. Sometimes you can even award them the best worker. You award them to encourage them, you know. You have to reassess, evaluate, and adjust, continuous reassess and evaluate. You know, the services that you are giving out, the staffs as well, there must be continuous evaluation. Foster collaboration. Again, you make sure that departments foster collaboration. That helps. You make sure that you can do skill set. Different departments can train. Other people can train. Training department will give training to the non-training department, where there are things that the training department will need from the carer department, they can pass on, because the carers that know the needs, the direct needs of patients. So there must be foster collaborations amongst them, you know, continuous improvement, you know, learn from successes and challenges and seek feedback. I've spoken about this already. Feedbacks and explain how to identify the skills required in management roles, one area of health and social care. So identify the skills required in management roles, a specific area of healthcare and social care provisions, such as hospital and social care services. Conduct a job analysis. So how do you identify the skills required in managerial roles? You have to, first of all, conduct a job analysis. You know, begin by conducting a comprehensive job analysis for specific management role. This involves identifying the core responsibilities of tasks and functions. Very, very important. In other words, you are doing a research. Conduct a job analysis. Review the industry standards and best practices. Familiarize yourself with industry standards and regulations. You know, so having conduct a job analysis by conducting a comprehensive job analysis for the specific job, you know, you then have to review the standards and best practices. You know, in the job analysis, you have to look at what we call the functions of the role, the skills, having done your job analysis within the company. So how do you know? Okay, you need job analysis. You might need probably there's a need for a senior carer. You know, so you do your job analysis to know if you need a senior carer, because probably you have carer, but you need another person that should be a team leader over those you have. So your job analysis will review. And then you can then assign the responsibilities and tasks and functions of this position. You know, speak to managers within that role so they can review the job description and gather more insights about it. Having gathered, then you can review the best practices relevant to this role. You know, so this will help you in your interview. You understand? And identify key competencies. You know, key competencies. I mean, competencies that would help to have competitive advantage. You know, this may include technical and soft skills, technical skills that areas such as functional management, quality assurance, human resources, key competencies, you know, within the sector. So you may also have staff who are already working, but you may also have a staff that is working with you already or within the organization, but may have extra skills. You have to identify them. They may be a carer, who may be a leader. By showing that, you can then give him a higher position as a team leader, because he's a carer as well. However, he has a leadership skill, so you make him a team leader. You may have a carer who may be very good in IT. So you could train him and shift him from the carer to the IT department. No, this is what we're talking about, soft skills that, and seek input from stakeholders. You have to also seek the feedbacks you are getting from other managers and all that, from the IT manager, from the clinical lead. Their feedbacks would inform you who to shift to a certain department and who to transfer and not, and conduct skill gap analysis. The gaps within, when you say skill gap, we're talking about the lacking of the gaps that people lack. When they lack this gap, you have to do that. Skill gap analysis, you do that to identify what they lack as competent people, and you ensure you do that. Design and training development programs. Again, having reviewed, like I did mention, design regular training development program. You do workshops, regular trainings, you take them to trainings where they have to train, you train them and all that. Encourage continuous learning. How do you encourage continuous learning? By engaging the staffs, engaging the managers, engaging subordinates for regular webinars and regular. You need to engage them and encourage them as well. Provide leadership opportunities, provide them, encourage them, include assign them to lead projects, cross functioning teams. When we say cross functioning teams, different departments, you send someone there to another department, you send another manager to another department, constant functioning, there's network, So in the care home, we have the clinical department, finance department, kitchen department, and all that. You do a cross-functional, they network each other. That's a common. You have to establish monitoring and coaching programs as well. Coaching, guiding them, trainings, skill development, take them out, take them to conferences and all that. Evaluate and assess progress. Regular evaluate, assess the programs of the managers acquiring the required skills. So you also need to more of evaluate and assess if indeed in management there's something we call lean operations. Lean operations, you want to see how you can use a little number of staff to achieve a goal by casting waste, So you have to review and see that at this stage of the quarter of the year or the month, have you achieved your goals? And if you have achieved those goals, you need to send a feedback, and you have not achieved. Would you need extra staff to achieve those goals? You have to do evaluations. So evaluation assessment will reveal that you may need more staffs. Like I didn't mention, the UK government have realized that they need more nurses in the UK. That is evaluation. That is assessment. And now they have changed the UK VI law, the Home Office laws, that they will need everybody to write IELTS exams, the English exams, So they evaluate the progress of what they have done. So when you follow these tests, you identify that the skills required for management roles in a specific area or health and social care profession, establish a comprehensive approach to skill development. This will contribute to the effectiveness and success of managers in fulfilling their responsibilities and ensuring the delivery of high quality care and services. Eunice, are you there?
Yes, please.
Good. Do you have any question?
No.
Are you sure?
No.
So Eunice, what role? Are you a senior carer or are you a normal carer?
Normal carer.
You're a normal carer. Okay.
Mm-hmm.
So go. In your organization, what do you do? Do you give feedbacks?
Yes.
You do.
Yes.
Is it daily? I'm sure you have a care plan, don't you?
Yeah, care plans I do have.
And do you have a communication book as well?
Yes.
You do. Amazing. So this communication book, what's the essence of it? Why do you think there's a need for the communication? What's the essence of it?
It helps to know feedback, like your progress in the career, what you like, you don't like, what's going on, in your career.
The career.
Yeah.
Amazing.
Amazing.
And I'm sure that you have regular trainings and all that, don't you?
Yeah, you do your e-learnings, yeah.
Amazing, the e-learnings. And what do you think? Why the need for that? Why do you think your managers have done that? What do you think was the reasons?
To update you with new things, in your career,
Amazing. Amazing.
more or less like an update, to update you.
Amazing. And I'm sure you have reminders, isn't it? You have emails to remind you every time if you have done it, isn't it?
Yes.
Amazing. And if you have not done your annual, your yearly care trainings, I'm sure they might not let you work, isn't it?
Yes.
Amazing. And then what about your DBS?
Yes.
Good. So in the management style, I mentioned the democratic and autocratic leadership. How do you see yourself being as a carer? I'm sure you're doing a level 4 program because you would want to probably get higher positions or go higher than your normal care, isn't it?
Yes.
Good. So how do you see, in terms of the approaches, how do you see yourself, the leadership qualities?
Democratic.
Amazing.
Yeah.
But don't you think that if you should also pick a bit of the advantages for the transformational, that would be very good?
Yes.
Because the transformational leader is the one that encourages, you understand?
Yeah.
And motivates. Yes. And motivates.
Transformational and democratic.
A bit of that should help. Yeah. How does your managers identify your skill gaps? Do you have regular meetings or monthly meetings, or with your immediate managers?
Actually, I just went there not long ago, so I don't know how they do their things. And moreover, I'm a night staff, so I don't know much.
You don't meet much of the day, but you need to have.
And I just went there not long ago, so.
Okay. What's the name of the care home?
KUK.
Oh, KUK. Oh, okay. KUK is a big company. Okay.
Yeah.
So are you a skilled worker or?
Pardon?
Are you a skilled worker?
Yeah.
Okay, that's fine. So I'm sure that you'd, being a skilled worker, you would then identify with all the things that they say, because before as a skilled worker, there are needs that you need to meet, isn't it?
Yeah.
But you need to have, whether you have your ATHE or you have your what do you call it? Your IELTS, isn't it?
Yes, it is.
Pardon?
Yes.
Exactly. So these are all needs that we did mention, that there should be a need, there should be a need, and then a strategic goal. So once there's a goal, the UK government realizes that a need, and then they put in a strategic planning in place. And the need is that they will need more nurses in the UK to come and work. They put a goals in here. Okay, we need to open our doors for nurses to come all over the world. However, we have to put in the requirement, isn't it?
Yes.
Exactly. So there should be a requirement. There is a need, there is a goal, and there should be a requirement. The requirement is that you ought to have gotten your this and that and trainings and all that. You ought to qualify for a visa to come to the UK. So these are the things that managers need to identify also in their workplaces. You understand? You need to identify the needs of your staff, the need of your workforce, and you have to do that by becoming more involved in and getting the feedbacks to reaffirm and assess that whatever that you are putting in place, or the policies of the organization, the general policy, because it's only the manager that will know the general policy, the general goals. And then you knowing those goals, you have to also put in certain things so that it will help those who are under you, as a leader. Yeah. So these are the entire thing that we need for managers in this course. Yes. So management of healthcare, that's basically what it is. You know, yes, basically what it is. You need to be able to be, you have to be well informed, you have to be a good leader, you have to be a good listener to be able to manage. And the key elements is strategic planning, organizational structure, human resource management, and financial management. These are things that you need to know. It is, you will know that. How do you know? By speaking to them, encouraging people, you will know that, oh, we have wives, our wives are finished, isn't it? Are you there?
Yes, please.
Yeah. So it is your staff, they are the ones to inform you that you need enough wives, isn't it? You need enough, exactly, for a care home, you know, enough rights, enough toiletries and all that. You know, there may be a department for that, you know, to be ensuring that you need have enough wives available, enough everything available, so that you don't run out of stock. So there's a department for supply chain department, logistic department, inventory store department, and all that. But they must work hand in hand with the carers, isn't it?
Yes, it is.
Yes, because it is the carers or the care team, they are the ones who can inform the inventory department or the stocking department or the supply chain department that, oh, we are running out of wives, isn't it? Before they can place order. So I mentioned something about what? Cross-functional. Cross-functional is a good leadership style, cross-functional. So you cross-functional, there is cross-information from different departments to achieve a common goal. These are all some of these things that you have to take notes of. Yeah. All right. So Eunice, if you have nothing else, are you sure you have no more questions to ask?
No, I'm good.
You are very good.
Yeah.
Okay, so please leave comments as well, okay?
Okay.
Yeah,
All
leave
right.
comments as well. So I think Johnny, we've been to about lesson 2, isn't it?
Yes, please.
All right then. Well, Eunice, I wish you all the best then. Okay.
Thank you.
You are welcome. You are welcome.
Have a nice one. All right.
Same to you. Bye. Bye.
Okay.
Bye.